My name's Rob Verkerk. Welcome to this latest Coronacast. In this video, we're going to look at 6 really key areas that are particularly rife sources of misinformation. This information has been emanating from governments, health authorities, and the mainstream media. First is the direct mortality from COVID-19. We still don't know how many people have actually died from COVID, only how many have died with COVID mentioned on the death certificate, whether or not this was or wasn't the result of a positive test. Last week in the UK, for example, even based on these dodgy data, the UK Office of National Statistics tells us that COVID-associated deaths make up just 16% of those from other respiratory diseases, and the number's getting smaller each week. As of week 25, mid-June, deaths from respiratory diseases actually overtook those from where COVID was associated with death. And healthcare professionals are already noticing an increase in respiratory infections, some linking this to increased mask wearing that are not COVID related. So let's not forget, lockdowns were meant to stop healthcare services from being overrun. They were never overrun, and there's now talk of more lockdowns. And again, healthcare services are a million miles from being overrun by COVID related illnesses. So why not business as usual? Why do we need a new normal with all that it entails when the scientific evidence overwhelmingly suggests it's time to revert to the old normal? We know already more people have died as a consequence of the collateral damage caused by government COVID policies than those who died with, not because of, COVID. That's only set to get worse if we don't soon revert to the old normal. These are policies that have been determined and organized in countries with supposedly democratic regimes without any recourse to the public's views or opinions. Mental health problems, suicides, and a rash of other diseases aren't getting the attention they need, and they're being exacerbated by the top-down totalitarian policies that are destroying lives and livelihoods with untold consequences, many of which we won't know for many months or even years. Everyone knows there's 2 types of tests. Antigen or PCR tests that are taken from a nose or throat swab that tell you whether or not you have the virus, and then the serologic antibody tests of blood samples that tell you whether you've been infected or not. Unfortunately, neither are accurate. PCR tests simply identify a particular genetic sequence that's common to the spike protein of the SARS coronavirus 2. It doesn't tell you if you're currently infected, hence the 50% plus reported levels of false positives. It also doesn't tell you anything about whether the virus has been the cause of any respiratory disease. And as for the antibody tests, these are notoriously inaccurate, especially in women or those who haven't had severe disease, which is, after all, the majority. There are different classes of antibodies, and most tests just measure one of these, most often just IgG. We now know another part of our immune system, the T-cell response, can remain elevated after infection for longer than antibodies, and you can't really get to the bottom of a population's immunity without thorough testing of all the antibodies and the T-cell responses, and that's just not being prioritized. That leaves us to speculate that there's probably little interest from those who are driving the agenda to understand the level of naturally acquired herd immunity in populations, as that'll probably reduce people's desire to be vaccinated when vaccines are eventually rolled out. The UK government has funded trials like Recovery that show that 1/3 of deaths linked to COVID can be averted if you use the anti-inflammatory corticosteroid dexamethasone. Then you've got other protocols involving steroids, anti-inflammatories, and natural agents like zinc, such as the MATH Plus protocol, that's been shown to be extremely effective in preventing deaths when delivered early enough. Yet, none of these treatments get formal acknowledgement by health authorities, probably because such acknowledgement of effectiveness prevents the vaccine manufacturers from being indemnified by governments, or should I say the taxpayer, in the event of vaccine injury. Governments have almost been unified in refusing to tell people to eat diets that are helpful to the immune system, or take simple and cheap supplements like vitamin D or herbal products that reduce inflammation in the body. More and more people are waking up to the fact that this decision to avoid talking about natural immunity is really much more about getting people prepared for a vaccine. So, why do we need to wear masks or face coverings in public settings? There's no scientific evidence to support it. So do governments who enforce the use of face coverings in public settings claim to be led by science? If it's not science driving these decisions, what is it? Could it be more about power and control? Is this some kind of a divide and conquer strategy that's causing a split in society between the obedient who wear masks and the disobedient? It's early days to understand just how many health and social problems could result from mandating the use of face coverings. So it's very relevant that we're already seeing evidence of increases in oral infections, skin infections, and even bacterial pneumonia in those wearing face coverings for long periods each day. The UK is the second biggest funder of the WHO and one of the leading funders of a vaccine solution. So can it afford to fail? Why hasn't the government told the public all previous efforts to develop a coronavirus vaccine in humans has failed? That the companies making the vaccines are indemnified by governments who are paid by us, the taxpayer, or that the candidate vaccines all rely on genetic engineering technologies that have never been used at the scale before. Why are we putting all our eggs in the vaccine basket when all the scientific evidence tells us people who look after their immune system either show no symptoms of disease at all after becoming infected, or suffer only mild symptoms, no worse than a cold or flu? There are, of course, exceptions. So there we have it, the big 6 areas of COVID misinformation as they currently stand. The data that informs each one of these areas are changing all the time. But what's been fairly consistent is that the general view being dished out by governments and health authorities hasn't represented the scientific facts accurately. Next week, we're going to be releasing a piece in which we fact-check the fact-checkers, this new and rapidly growing group of often anonymous individuals who are working tirelessly to marginalize any information that doesn't fit with the mainstream agreed narrative, one that we and many other scientifically based organizations and groups agree is seriously misinformed. Our most powerful weapon against misinformation, from wherever it comes, is good science. That's been central to our own mission at ANH since we set up over 18 years ago. Please help those around you to understand just how insidious the misinformation is by sharing this video with those you care about and those in your networks. Please also don't forget to subscribe to our YouTube channel if you want to see and share more videos from us. Thank you very much.